NACDL is the association of the nation's criminal defense bar.
I'm Jeremiah Goulka. I'm with the Health and Justice Action Lab at Northeastern, and I also want to thank the hosts of this event, people who made it possible, Bonnie, Kate, Representative Inamorado. Thank you so much for those powerful talk. I'm just going to basically provide us a quick slides that just provide a little bit of data support for what you've already said. And I hope you get out and are able to share your messages far and wide, because a lot of people need to hear this. And our panel, we're going to give a quick rundown on the national and Pennsylvania perspective, mostly on the policy front, before we get into the deeper aspects of the law. I'll let my fellow panelists introduce themselves when they start. So I'm just going to go quickly. I have a little timer here so I don't take too much time. So we all know there's been a huge surge in the number of these prosecutions that have happened over time. This data comes from a study that my colleague Leo Beletsky ran, which was using a tool to scrape media mentions of these types of charges. The meaning of that is that this is just the tip of the iceberg. Here's a quick map of the states with statutes. About half of those had them before the start of the current opioid crisis. The other half are since. But of course, states that don't have a specific statute can just use their more traditional criminal law. We're in Pennsylvania for a reason. You can see Pennsylvania is number one. Yay! And here are the counties, and you'll be able to see which are the Pennsylvania counties that are most active. Josh Vaughn is going to get into more of the Pennsylvania-specific stories in a minute. There are a litany of policy problems with these types of prosecutions, and I'm just going to talk about the few at the top. So first of all, who's actually getting prosecuted? We hear the language is always that we're going to go after the big sellers, the kingpins, the major traffickers. Of course, that's the only people we would go for, right? That's what the bills say. They're never going after mere users, right? Obviously, that's not what's actually happening in enforcement. What we're finding, this is another more research done by our lab, that at best, half of the people who are being prosecuted can even be considered dealers in one way or another. And in terms of people who are those major traffickers or kingpins, it's almost not happening at all. So the effect of that is direct conflict with Good Samaritan laws. So just the quick rundown there on Good Samaritan laws. Most states have them, the federal government doesn't. They vary on what crimes are covered and where the specific process of them. Where in the criminal justice process they provide immunity. There's not that much information out there on them. But there's a lot of information out there in the media about enforcement efforts. There's much more mediagenic, right? So and you get real mediagenic images like that from Florida. I just want to show that slide again because it's saying these are media mentions. So we have hundreds and hundreds of media mentions of these cases. Well, the impact of that is that people who are actually using opioids know that if you call 911 and you're doing help seeking to save somebody in an overdose, you know that calling 911 brings not just EMS, but it's going to bring law enforcement. And there's study after study showing, validating what everyone was assuming, that people are going to hold back from calling 911 if you know that you're putting yourself or the person suffering an overdose at direct risk of being arrested. And if the person dies, then you have this terrible choice, right? Where if you call, maybe you're in a state with a Good Samaritan law, but then the person dies, now you've basically introduced the law enforcement to come and arrest you for a homicide, which is not such a good situation. Anyhow, this is an interesting study that's it's not published yet, but it'll be coming out, that Leo's worked with some other statisticians to see how many more people are dying who wouldn't have but for the fact that the drug delivery resulting in death prosecutions are happening. All right, quick, moving on to the problem of race. Yes, it's as Representative Inamorado said, enforcement is showing a lot of disparate impact and as far as discretion by prosecutors is going. Focus is on white victims, but a disproportionate number of people of color are getting prosecuted, with also disproportionate results in terms of sentencing. As you can see, median sentence for white defendants is 5 years, but it's 8 years for people of color. I'm racing through here. There are a bunch of other problems here with these types of prosecutions, but I'm not going to cover them now because I want to hand over the panel. But I've put down a few resources. In the PDF that Bonnie sent around includes our latest version of our drug-induced homicide defense toolkit. The Drug Policy Alliance also has a great report out. The Legal Action Center has a number of reports that will cover particularly the ADA Rehabilitation Act issues. And of course, there'll be time for questions at the end. I'm going to hand it over to Josh Vaughn.
Hi, so I'm Josh Vaughn. I'm a reporter with The Appeal. We're an online nonprofit news outlet covering criminal justice issues. I am from the area. I'm Central Pennsylvania, born and raised. Before coming to The Appeal, I worked for newspapers in the area. So this is an issue that kind of got on my radar just because of where we are and kind of what we're going through. And Central Pennsylvania is kind of leading the way with these charges. I mean, just a quick, I'll kind of gloss over this, but I mean, the drug delivery resulting in death statute is not new in Pennsylvania. I mean, we've had it since '89. It's gone through several iterations and changes. 2011 is about the last time it's really been changed to get it into its current form. But what's happened in Pennsylvania? So around 2013, statewide, about 15 cases filed in the entire state. By 2017, that number had jumped to 180 and stayed about there in 2018 as well. And there were sharp spikes basically in 2014 to 2015, and then 2016, and about 75 cases 2016, and then 2017 jumped up to 180. But when we talk about the rise in these charges, we're really talking about maybe 5 or 6 counties. You take Cumberland, York, Dauphin, Lancaster, and Franklin County. Those 5 counties alone on an annual basis make up about 45% of the statewide drug delivery resulting in death charges. Those are the counties that just have made this massive surge in the use of these charges. To put that in perspective, those 5 counties account for about 13% of the state's population, so 45% of the charges, 13% of the state population. Put it in a different perspective, again, 45% of the annual charges, only about 10% of the overdose deaths between 2015 and 2018 occurred in York, Cumberland, Dauphin, Lancaster, and Franklin counties. So they are drastically outsized compared to most other places. When you throw in Westmoreland County into that, you've now jumped over 50% of all drug delivery resulting in death charges filed in the state come from those 6 counties. And there's really little evidence. Obviously, there's a lot of talk that these charges are going to reduce overdoses, and this is going to be the way that we get ourselves out of it, that we're going to go after the kingpins and get them off the streets, and that's going to take the drugs away. It's kind of a mixed bag with how those counties have gone. Dauphin County, since 2015, as of 2018, their overdose deaths were up 50%. 2017 to 2018, up 20%. Cumberland County is up about 25% since 2015, but down about 40% between 2017 and 2018, and there's some indication that Cumberland County is actually now moving back down below 2015 levels. York County, up 72% since 2015, but basically flat between 17 and 18. Lancaster up 25% since 2015, down about 40%, 17, 18. Franklin County 50% up, 10% down the last 2 years. Westmoreland 45% up, 40% down between 2017 and 2018. And as we're saying, the bills obviously get sold and the law gets sold that we're going to go after the kingpins, the high level dealers. It's a little hard at times to think that we went from 15 kingpins to 180 in the state in a matter of 5 years, and that the expansion has only been because we're, somehow getting better at finding these people. I mean, the reality is that that's not who the charges are getting used against. There's kind of 4 buckets probably that you could probably put it in as to who's getting charged. There's the quote unquote for-profit dealers. That seems to be the minority of cases. Cumberland County had a case a couple years ago, Corey Paulson. Probably the highest level I've seen of someone getting charged, and we're still talking a guy from central Pennsylvania who every week or two would drive out to Philadelphia, bring some drugs back and sell them. I mean, that's how he was making his living. But we're not talking a kingpin. We're not talking that they brought down El Chapo by arresting him. He was tied to 3 deaths, including 1 overdose death of his girlfriend, who she actually didn't die from the overdose. She overdosed while driving from drugs that he gave her. She crashed her car, and they charged him with a drug delivery resulting in death with that one. So the next bucket is people selling, but mostly selling to continue their use or as part of their use, and those are probably the more abundant if you talk about the traditional dealer relationships, and there's a lot of those. Then you have the people who are just simply sharing. They're not really in it for profit. They're not really in it for all of that. And you have people like Glenn Perella in Allegheny County shared drugs with his girlfriend or friend. She overdosed. He attempted to use naloxone, called 911, stayed, did all the things that we kind of want to incentivize people to do in the instance of an overdose. And he got charged with drug delivery resulting in death and is now looking at standard range beginning at 5 years for someone without any prior record. And Cumberland County just had a case where 3 women were sharing and using. One of them started to overdose. Instead of calling, they dropped her on the side of the road, and she overdosed. She died as a result of that. It seems to be Cumberland County. Jumping around a little bit. Cumberland County is a little bit fascinating because prior to Dave Freed, the now U.S. Attorney in the Middle District, he was the District Attorney in Cumberland County. Prior to about 2016, Cumberland County largely led the state in the number of charges that were brought. That tended to be because Dave would bring 3 or 4 charges a year and just did that steadily. And this is happening at a time when most counties were not bringing those charges. In 2017, he was appointed to U.S. Attorney. 2018, Skip Ebert took over as District Attorney. In the first 18 months that Skip Ebert was District Attorney, he has filed more drug delivery resulting in death charges than Dave Freed, who previously was the most prolific user over his entire 10-year career. There were 22 charges filed within the first 18 months. There were about 21 over Dave's entire career as District Attorney. And again, Cumberland County just had a case where 3 women were using 1 overdoses. Instead of calling, they leave the woman on the side of the road. She winds up dying instead of getting the help that she needs. And then you kind of get into the bucket of the real tragedies. Not that any of these are not tragedies, but very overwhelmingly policy failures in other areas. Dauphin County, where we are right now, just charged a man named Michael Leary with murder, not drug delivery resulting in death. They're actually seeking a 3rd-degree murder charge against him. helped his girlfriend get drugs. She started to overdose. He had Suboxone, thinking that it would work like naloxone, and gave it to her, which obviously did not reverse the overdose. It compounded the overdose and caused her to die. Never called 911. Obviously, then you start to panic, and there's all those issues. You have a Robert Martin in York County. His girlfriend had been sober for quite a while. She decided she was going to start using again, or had started using a little bit, wanted to get into treatment. Knowing that she wanted to get into treatment, she felt that if she wanted to actually get a bed, that she would have to test positive for something. So Robert took his girlfriend down to Baltimore, helped her buy some drugs, brought her back. And given the changes in the drug markets, with heroin now being largely adulterated with fentanyl, she used, overdosed, and died. So he got charged with drug delivery resulting in death as a result of that. He was acquitted at the end of that. So that's I guess the upside with that one. But that's one where better access to treatment. It's hard to believe that that's a case where this is truly you're going to enforce anything more. This is somebody who needed treatment, wanted treatment, just didn't know how to access it, or our policies to get that person into treatment is what led to this. And then you got Aaron Hines, York County. He had been sober for a year, started using again with a friend, decided to go to Philadelphia. He drove out to Philadelphia to pick up drugs. And again, same situation where you had been using prior was heroin. It's now basically fentanyl. He uses on the way home, overdoses, crashes his car, warns his friend that the drugs are stronger than he's ever used before, pours out most of the drugs and replaces it with sugar, but leaves a couple bags there for him to use. His friend overdoses and dies, and he gets charged with drug delivery resulting in death. And Tara Lefevre in Cumberland County, and this is one that when we talk about the expansion just on kind of an absurd level, she was charged and is I believe still going through the process, or she may have pled out at this point, conspiracy to commit drug delivery resulting in death. She is someone who had substance use. The person who was selling drugs to her made her an offer that if she helped another person who was going to buy drugs off of him go into the grocery store and make sure that when he used his food stamps to buy groceries to trade for drugs, that he was picking out the right groceries. So that she went in, helped. He bought the groceries with his benefits, turns around, he gets the drugs, overdoses, and dies. But because she is connected to that transaction, she got charged with conspiracy to commit drug delivery resulting in death. And I mean, and these stories just kind of go on and on and on. Most of them are not the for-profit. It's largely people sharing, or people who just get caught up for different reasons. And obviously there's a big point of that Leo has talked about before, just the connection to where the person has to be in the stream to have the evidence to do this. Drug delivery resulting in death tends to be a rural issue in Pennsylvania. Philadelphia has filed no charges since Larry Krasner took office. Prior to the 2 years prior to him being in office, it was maybe one or two. Even in Allegheny County with Pittsburgh, with being a more urban area, and Zapala, District Attorney Zapala using the charge more, it tends to be in the more rural areas. Same with York County. It tends to not be York City where the cases are coming from. It tends to be the suburbs and those areas. So again, I mean, it's a very disparate down to just a few counties. It's not that other counties aren't using it, but when we talk about the surge in the number of these charges, it's 5-6 counties that have just decided this is the way they're going to go about it and have gone full in on charging these cases.
Thank you. Hi, my name is Lisa Newman-Polk. I'm a lawyer and a clinical social worker from Massachusetts. I'm also on the next panel, and I'm actually going to reserve a lot of what I was going to say here for then to help us get back on time, and I also think it'll make a little more sense. What I just would like to add here, my work, a lot of it has been around special litigation related to addiction in the criminal justice system. So Jeremiah, Leo, and I worked on an amicus brief in Massachusetts in a case called Carrillo, which should be in your materials, that had to do in Massachusetts with involuntary manslaughter. So we don't have the drug-induced homicide law, but it's backdoored in through involuntary manslaughter. And actually, we just got the decision a few weeks ago that we won. And I know that Pennsylvania is in a different place, but we need to get you moving towards the Massachusetts decision. And so it appears that that's going to take work through the legislature, ideally, and then maybe through some more creative litigation to keep pressing the issue of the science of addiction and why these laws do not make sense. So from a policy perspective, I think I'm saying what we all realize, right, which is that our laws are perversely doing the opposite of what we want them to do. First of all, most people are overdosing and dying because they don't know what they're taking. So if you don't know what you're ingesting, we're putting people at high risk. So by not allowing safe consumption sites, by not having a clean, regulated market, people don't know what they're buying, and we're ending up with these types of deaths. So the more that our drug war laws keep trying to restrict and stop, we're actually getting the opposite result with more deaths. The isolation problem of people ending up using in isolation because they are afraid of being charged with these types of crime or this crime. If you know that if you're connected to having given to shared or sold or whatever to somebody, it's incentivizing to not be around that person and to not be with somebody while they use. And we on a policy level want people, because we're not going to be able to just stop people using by just saying you should stop using. That's obviously not working. So we want people to be with someone else. We want people to use the Good Samaritan law, to call for help, to call 911. But by having these types of laws, we're obviously doing the opposite. So having been a public defender in the trenches, I understand if I'm talking to public defenders, it's like, well, that's great, but we need to change the laws, and that is definitely true. So I'm going to leave it at that for this section and get more into how we can use addiction science to help us with arguments in the panel coming up right now. Are there questions?